Sometimes we may think, oh, well, this person looks normal, right? In quotations, but we learn that there's so much more that goes on inside, right? Then we're going to talk about how culture sees mental health and how that differs from certain people, because obviously we're a melting pot. Everyone has their own different views on mental health. So that's what we're going to talk about. Resiliency, it's a huge one in psych. And we're going to identify how culture influences the view of mental illnesses. Okay? The world of mental health, this is what we're going to talk about. Excuse me. So, mental health, okay? Do you have a healthy state of being, right? When you think about it, you're at West Coast University. You have all these. Are you traumatized by your experience at West Coast so far? Are you stressed out? Okay. Can you recognize your own coping mechanisms? That's a big white yes, right? Can you recognize your own coping mechanisms? If you fail a quiz, do you sulk around? Do you kind of stay paralyzed for a week and cry about it? Or do you stay resilient? Do you cope with this normal stress and think, hey, I'm not going to cry for like a good week, but I'm going to what? I'm going to power through it. No crying. We're going to power through it. We're going to cope with normal stress because that's what keeps us. We're going to hide a little bit, okay? We're going to hide a little bit by Zooming with me if that happens, right? We're going to work productively, okay? Your self-esteem, your self-worth. Oh my gosh, you guys, positive. Let's stay positive. Depressed and angry. Oh my gosh. Crying for 2 minutes is okay. Crying for 2 minutes is okay. Buy a good lunch and dinner. Yes, you guys. Or coffee. Coffee. My coffee intake. Look at this. This is cup number 6 today. This is how I cope with my stress. Okay? Coffee. Take my stress to the gym and work out. Sleep, watch The Office. Run. Right? Right? You guys are taking PA, right? Like Beyonce said. Yes. That's a good motto to have. That's a good motto to have. Use the voodoo doll on the student. Oh my gosh.
Joking.
I love that. I want to say you may not be joking. There's so many different ways we cope with stress. That's one of them. That could be one of them. Okay? That's totally fine. But I know you guys are taking what? PA with mental health. And that's very hard, right? That's a very, I want to say, odd combination of classes to take. They're both just as tough. They're both just as rigorous. But you know what? Okay, we're going to power through. Okay? We all cope in our different ways. So this is what makes you healthy. Okay? We power through it, right? Our coping mechanisms, we have a tougher state of mind. We utilize what? Exercise, food, our positive coping mechanisms to power through it. When it comes to your psych patient, that's a little different, and we're going to dive into it slowly so you guys can understand the comparison between one another. Okay? Oh, hi, Teresa.
Hey, here I am. Sorry to interrupt.
No, it's okay.
All right. So, hello, students. I'm Teresa Meredith, and I am one of the nursing academic specialists. Can you see me? I can't see myself.
I can't. I could see.
Not that I. Do I look fabulous? Do I look like a mother? About ready to scream? No. Anyway, so I'm one of the nursing academic specialists, and I work specifically with mental health students. So I am a tool in your toolbox to utilize. I'm sure you guys have received a few remind messages already from me with my contact information, which I also threw in the chat right now, and with my Calendly link to make an appointment with me. So if you guys are repeat students, if you've taken mental health before, failed, and are back again, I would love to see you once a week. They're trying to make that a requirement, but honestly, I feel like it would help you. And also, I start my workshops next week on Monday and Tuesdays at 12 p.m. So if you can come to one of those, that would be great. If you can't, that's fine too. You can always meet with me separately, even if you're like, Teresa, I only have 10 minutes, or I'd like the full 30 minutes, or whatever. Just let me know. I'm literally flexible. And I do work Monday through Wednesday. So I know some people send me messages on Thursdays and Fridays, but I am not working. I am a mom on those days. So, but I work in collaboration with the professors in mental health. And our goal is for you guys to succeed, to work hard, and to feel confident. My goal is not for you guys to fail. But in order for that to happen, we need you to put in the hard work, okay? So please make sure that you make time to study each and every day. And, you know, do practice questions also. And I'm just trying to think. Utilize PALS. I think we should be getting their schedule soon. You know, utilize anything that works for you. Working in a group, studying if that helps for you, whatever. If you ever have any questions, let me know. Let your professor know. She's amazing and very responsive, you know. So I'm trying to think if I'm missing anything. We can go over test taking strategies. We can go over time management. We can go over basic concepts. We can do some practice questions. We can, whatever. I'm literally here. So don't ever be afraid to reach out. Does anyone have any questions?
Answer Chan.
No. Okay, well, I'm sure I will see some of you guys, and good luck. Start studying tomorrow when you're done with class, 3 hours every day. I'm sure she'll give you some tips on what to focus on and things like that. So please take all this to heart and be confident, believe in yourself, and know that you can do this. So take care and have a good night and sleep well, everybody.
Thank you.
All right, bye.
Bye. All right, guys. That was good, right? Another resource. Definitely utilize her. A tool in your toolbox. How lovely is that? All right. Where were we? We're talking about voodoo dolls, right? Voodoo doll, the person who scores really well. Okay. We're talking about coping mechanisms, right? And since you are healthy and you manage stress so well, you've gotten this far. You've gotten to mental health, right? So what makes you healthy is you're able to recognize your own potential, you cope with normal stress, you work productively, right? And that's how you contribute to your community, your West Coast classmates, and that's how you do very well in class, right? That's what makes you healthy, okay? Now, let's dig a little bit deeper. Okay. Now, traits of mental health, right? Positive, right? Positive traits, healthy traits. Look, it's even bolded, and I wonder why, right? So, when you're such an amazing nurse, right, and you're evaluating outcomes of an adult patient on the unit, right, and you're trying to think, is this person ready for discharge after you've cared for them? Are they mentally stable? You know, and you know they're ready to be discharged when they are able to achieve ideals and meet demands, because that's how you are mentally healthy, when you're able to achieve and meet demands, when you're able to cope with stress. Okay? Are you able to think rationally? Okay? Should you really be studying until 2 a.m.? right? Pulling an all-nighter to study. Should you really be doing that in the first place? Should you be watching The Office until 2 a.m., right? Or can you think rationally and study during the daytime? Can you communicate appropriately? Or are you hyper-focused on one thing? Learn, grow emotionally, be resilient. I keep mentioning resiliency constantly. I wonder why, right? That's what it takes. It takes resilience to manage through stress and anxiety. It takes resiliency to be an amazing nurse, right? Can you withstand or recover quickly from a difficult condition, right? From a difficult situation. um, right? God forbid you get that low grade. We need to be a little more resilient. We're gonna move forward. Okay? Do you have a healthy self-esteem? Do you have a realistic goal? Okay? Do you have a realistic? So all of these are traits of mental health. Okay? And when are you able to discharge your patient? When they're able to achieve ideals and meet demands, and that's what makes you healthy too, right? Makes sense, guys, right? Did I paint the picture? I painted a really good picture, right? Sure did. Okay. What do you guys do for a good, positive outlet? What do you guys do? What do you do for fun? What do you guys do for fun? Let's hear it. I want to know what you guys do for fun. Because it doesn't matter that West Coast is so hard. Eat, work out. We need to go out and party, sleep. Travel, work out, vegan. Oh, you're vegan. Okay. Park with my babies. Oh, moms. There are moms in here. I love that. Read, sleep. I love to read too. Too bad you guys can't see my bookshelf. We moved. But always when I have lecture, I'm always like, I have a huge bookshelf with lots of books. I'm a big dork. Hang out with family and friends, cook and bake. How about watch stuff? Do you guys not watch movies? Does no one watch any movies for fun? Grey's Anatomy, Money Heist. I always want to cry. That's very psychiatric, by the way. I have to watch Squid Game. So yeah, we all do stuff for fun. Okay, we all go to the movies. We take a walk, right? Spend time with family and friends. We all need at least 5 minutes to ourselves. Okay, without a healthy state of mind, you cannot function. Okay, we're so used to this med search type of mind, right? Walking into our patient's room thinking, let's fix the problem physically, but there's also the mental health side of things, and we always forget to ask our patients on the med search floors, how are you really feeling mentally? Okay, we're going to learn about that. Nice. Oh wow, look, resiliency again. I wonder if resiliency will pop up on your exam, since I mentioned it 5,000 times already. Okay, I wonder. Ability and capacity to cope, deal, behave, and it's bolded effectively with life challenges and stressors. Wink, wink. Okay. It seems like it's just a word, resiliency, but I promise you, I have students messaging me from terms before, and they're like, Professor, I keep resiliency in my mind. I always remember you telling me to stay resilient because it's hard. West Coast is hard, but who cares what comes your way? We're resilient, right? Every class is harder than the next, but it's okay. We power through it. We secure resources needed to support our well-being, right? This resiliency is essential for recovery from an illness, and they're closely connected with optimism, confidence, and sense of mastery. Okay. Here's the thing: our psych patients on the units, they lack all of this. Okay, they lack coping mechanisms, they lack support system, and this is why they come onto the unit, so we can care for them. We can help them be resilient. We can teach them to be resilient. We develop coping mechanisms, cognitive behavioral therapy. We'll discuss that all the time. This is very important. Okay, Office fans, what do you guys think? Michael Scott lacked resiliency, right? right? He lacked so much resiliency. That one episode, excuse me, that one episode where he wants to prove that his job is just as stressful. He buys that bouncy house. You guys remember that episode? And he wants to prove to them. See, that episode was really funny, but I also saw a whole lot of psych. I thought he was gonna the depression one, yeah. I thought he was gonna commit. I really thought he was gonna commit suicide, and suicidal ideations, right? Passive, indirect. We're gonna talk all about that. See, The Office is educational too. How wonderful is that? Okay. So we talked about being healthy. We talked about what makes us so resilient, right? Mental health, mental well-being. Let's dive into mental illness. Okay, let's dive into that. Disorders with definable diagnoses, undefinable or unknown diagnoses. Okay, what are some diagnoses you guys think we're going to talk about this term? Let's utilize that chat. What do you guys think? What are we going to talk about? OCD, big time. Anxiety, depression, ADHD. We're going to talk about every anorexia, bulimia, MDD, bipolar. We're going to talk about all of this stuff. That's mental illness, right? We're going to talk about their backgrounds. We're going to talk about possibly them being more predisposed to it due to genetic predisposition. So all of it comes into mind, right? All of that has a lot to do with our patients being what? Lacking coping mechanisms, lack of resiliency, right? So we talk about developmental, biological, physiological, all of that, okay? All of that. When it comes to mental illness, I do want to, bring in culture. In American society, what do you guys think? We're very open at this point. I think Gen Z is very open, right? Even millennials, very open. Our generation is very open with mental illness. Let's talk about it, right? Although certain other cultures, they do have stigma, right? There's this big stigma when it comes to mental health, okay? Taboo in collective cultures, right? It's kind of like, let's throw it under the rug, right? Let's not really talk about it. So a lot of, and religion also, big time. Religion also, big time, okay? But, I think celebrities in today's culture, they kind of, because they're so open, what do you guys think? Because they're so open with discussing their mental health issues, a lot of people start to open up too, right? What do you guys think? So I think our modern generation will open to it. But we're going to discuss certain cultures. They see mental health illness very differently, especially with especially with social media. Yeah, I'm so not up to date. What was her recent situation? My friend was talking about it, but I wasn't really. Can you tell me? No? Briefly? Oh, yes, duh, of course. Yes. And what I loved is that people were on her side. People were actually on her side. I remember that. Blanked out for a moment. Oh. And it's really sad. Really, really sad. Yeah. Okay. Mental illness continued. So we just discussed, with culture, mental health is different. So we know that mental health illness changes with time and history, culture, and political system, right? We're going to talk about, can you guys hear? Really bad? Okay. Perfect. So with mental health illness, it changes with time and history, culture, and political system, right? We have all these different funding available due to, whoever is part of the political system who actually wants to provide help when it comes to mental health. So this is what you want to educate all the student nurses on. You want to educate your student nurses on that mental health illness changes with culture, right? Changes in time with culture, history, and political system. If I could bold that for you, I really, really would. Okay? So that's something that you want to educate everyone on the unit. Okay? Now, attributes to mental health illness. Now, I'm not sure if you guys have some form of medical background. Maybe some of you guys work in mental health. I'm not sure. Maybe you've already, I don't think you guys have already had your clinical day. I'm not exactly sure. But when you think about someone who has mental illness, what are some things that come into your mind? What do you guys think of seeing physically? Hello? What do you guys think you will see with your psych patient? Lethargic, unkept, okay, aggressive. That's not always the case. We're gonna learn that it's not always the case. Sad, right? Sad a little bit, anxious. So, lack of energy sometimes, right? Sometimes very nice. No, a lot of the times they can be nice, right? Anergia, which is what? Lack of energy. Anhedonia, differences in body postures. Maybe they're isolated, yeah, not present, right? Maybe they're avoidant, right? Lack of energy, lack of pleasure, avoidant from family and friends, consistent sadness, discouraged, and hopeless mood. It's even bolded. I mean, it's even bolded. So, these are things that we imagine when we think of describing someone who has mental health illness, right? These are some traits. And as we move on throughout the term, we're going to learn more about how we describe our patients, okay? So if I'm in the ER and I walk in to assess my patient and I see them being sad, discouraged, a little hopeless, lack of energy, maybe guarded, maybe unkept, okay? I'm going to think, wow, maybe I should refer them to be evaluated psychiatrically, right? Right? And then a lot of the times our psych patients hallucinate too. So in the American society, sorry guys, in American society, if someone is saying, hey, I hear God's voice speaking, that's deemed psychiatric, right? That's deemed psychiatric because it's a hallucination, right? Any form of hallucination is deemed to be a form of psychosis. So if your patient says, hey, I hear God's voice speaking, then you know that something is going on psychiatrically. But in some cultures and in some religions, actually hearing God's voice is something it's very common if you're very religious. Right? So that's why we need to learn a lot about the cultures we care for. Okay? Does that make sense, you guys? Does that make sense? Yes? It only makes sense to a few people. Thank you. Okay. Okay. Diathesis stress model. Let's go over this. Culturally competent is very important. Yeah. I mean, culture does play a huge deal. Like, I'm Russian Armenian, right? If I tell my mom I'm stressed out because I have jobs, I'm in school, whatever, she's gonna be like, what do you mean? At your age, I had a husband, I had a mother-in-law, I had kids. What do you have, right? It's not because she doesn't understand. I want to say it's very generational and it's very cultural. Like, for them to be stressed out, it's a whole different understanding. I know that a lot of other cultures are very similar, right, guys? Right? Right. Hispanics are like that too. Yeah. Asian cultures. Yeah. A lot of different cultures are like that. True. So true. Yeah, that's why it's very important. Now let's talk about diathesis stress model. Like, what the heck is that in the first place? So diathesis stress model is basically your response to, if someone says, well, why do people get psychiatric illnesses, right? What's the framework behind it? Diathesis stress model is really your response, okay? It's basically nature versus nurture, okay? Okay, it's basically vulnerability, right? It's between inherent vulnerability and environmental stressors, right? So people are born with a certain biological or genetic predisposition to a mental illness. Genetics has a lot to do with it, right? Genetics, if one of your family members has a mental health illness, you will have a higher chance of possibly going through a similar situation, or maybe you're brought up in a negative experienced a traumatic past, right? All of that comes into play. Biology and environment work together on people's minds. This is diathesis stress model. Okay, this is what this means. Okay, although I want you guys to get the understanding that mental health affects everybody. You could be the richest person on planet Earth from the most intelligent family, and you can go through mental health illness. Or you can be on the lower side of the social and financial demographic. It does not matter. Okay, it does not matter. It just has to do this is the response to it. Environmental versus genetic predisposition. Okay, story time. I recently cared for someone who was a neurosurgeon. Okay, smart, wealthy, highly intelligent. What happened was her mother committed suicide in front of her. She committed suicide in front of her, and so since she lacked coping mechanisms, she reached for the alcohol to cope with it. So she would drink like 5 bottles of wine every single day. So guess what? She's a neurosurgeon who has genetic predispositions since her mother committed suicide, plus the traumatic experience that her mother did something like this, and lack of coping mechanisms. Okay, genetic versus environmental traumatic experience, diathesis stress model. It's very traumatizing. That makes sense, right? What I'm trying to say, right? She lacked coping mechanisms, she lacked resiliency. So it really does not matter how intelligent you are or where you come from, right? It's all about nature versus nurture. Okay, that's all this is. It's a combination. Even if you're the richest person alive, yeah, you and I can be having can go through mental health illness. I went through an eating disorder. I had anorexia, and I'll talk about it when we cover eating disorders. Someone who's sitting next to you can actually have a mental health disorder. So it's more than just, you know, having the stigma that only certain people have mental health issues. And I want you guys to understand that. You know, life changes constantly. Absolutely, it throws you curveballs, right? Gosh, we're renovating, and so the dust I'm inhaling and I'm coughing. I don't have COVID. Okay. I'm not gonna discuss this in depth, but your book does, right? It's just some statistics, some important factors, just for your info. The prevalence, right? Major depressive disorder, leading cause of disability in the US, schizophrenia. This in the weeks to come. Okay, what do you guys think? COVID increased incidences of mental health, right, guys? What do you guys think? Right? Yes? Totally. Isolated. Depression. During COVID, did you guys read through the news? I mean, I was paying a close attention to this. Kids, like 12-year-olds, 13-year-olds were committing suicide because they were so overwhelmed with what was happening. You guys remember this? I mean, I remember reading this and I was traumatized. I was very upset. But affected everybody. Excuse me. Yeah. Yeah, it's sad. I wish I could see all of you guys. When I share my screen, I just see like a bar. Yeah, I know, very random, but you know, all of you guys have all these lovely comments, and it is very sad. Now let's talk about social influences. Okay, you guys better be smiling. You guys better be smiling. Okay. Social influences. So mental health used to not be what it is today. Okay. Before, it was believed that mental issues were due to demonic forces. Okay, if you had a mental health issue, then you had a demon. Okay, as a matter of fact, some cultures still believe this. Some cultures still believe this, right? But so much has changed. Okay, psych patients used to be institutionalized. Psych patients used to be just not treated humanly. Okay, so in 1950, this beautiful drug came out called Thorazine. Okay? Beautiful drug called Thorazine. What's Thorazine? You guys have, it's an antipsychotic. I'm not sure if you guys have heard of it, but we're going to talk about it next week. But before Thorazine, it was all about treating our psych patients inhumanely because people didn't know how to treat psychosis like episodes, hallucinations. People were afraid. And then in 1950, Thorazine came out, and it was this beautiful drug with the worst side effect, but it helped out with the signs and symptoms, right? Beautiful, okay? And then as, we progressed in the world, 1960, John F. Kennedy deinstitutionalized, okay? He provided federal funding for community centers. Isn't that lovely? In 1980, Jimmy Carter provided more funding. Okay, so as time Bush, he in 2003, he provided funding for schools. Okay, so children, kids with mental health illnesses can go to school. Okay, that funding was available, and then in 2010, Affordable Care Act, so more people had access to mental health care. Okay, so from demonic forces to 1950 Thorazine to 2010 to now, so much has changed. Kind of cool, right? Right now, we're all about meds. We utilize meds all the time. And therapeutic communication. It's all about talking to people, right? There's power in communicating with one another, okay? That's what psych is all about. Do you guys have a site? You guys have a clinical site? Or are you guys stuck on 7 Cups? Mission. Is it Selena with Mission? She's my BFF. She's the greatest. Oh, it's nope or yes. Oh, I don't know who Shannon is. Tell out. If you guys have Selena, my gosh, she's awesome. Love her. You guys will love it. Enjoy it. When you guys go into the unit, enjoy it. Look around. Vista Del Rey, was that fundamentals? Right? Nice. So maybe you guys will get to see psych patients and you guys will understand what I'm talking about, right? Okay. Now, we have all these meds available, all this funding available. Where the heck do you come in? Okay? Excuse me. So there's this idea that people have, student nurses, that psych nurses lose all clinical nursing skills. What do you guys think? True or false? True or false? False. Yes. If you lose your nursing skills, you should not be a psych nurse. We don't lose it. It's very important to understand that with psychiatric nurses, we use complex communication skills as well as critical thinking to solve multidimensional problems. We are challenged by those situations. Bold. Hint, hint. It's very important to educate the student nurses and educate one another that as a psych nurse, you don't lose your clinical skills, okay? It's a whole different dynamic. It's a whole different approach, okay? All of my psych patients, they have medical problems. They don't just have hypertension, right? Or most of them, or they have diabetes, or they have GERD, or whatever other medical issue. So we utilize everything together, okay? And we have to educate everyone, such as the student nurses, that psych nurses use complex communication skills as well as critical thinking to solve multidimensional problems. That's so important to understand, right? We have a different set of skills, okay? We must be able to help our patients medically as well. Oftentimes, psychiatric symptoms present themselves because of a medical issue, and you have to be very vigilant as a nurse to understand that. So before you even reach a psychiatric diagnosis, you have to understand, wait a minute, is there a medical issue going on? If someone's hypoglycemic, they're possibly hallucinating. Are you going to think that they're schizophrenic all of a sudden? No, you're going to treat that issue, and then you're going to reach. Am I making sense? So it's important to understand that. Okay, psych nurses, we deal with a whole lot of loss. Nerves of steel, right? We're very patient. It is very hard to talk to a psych patient. Very, very hard. So if someone says it's easy to be a psych patient, send them my way and I will argue with them and I will win. Okay? So it's very, very hard. Okay? Very hard. On your exam. Okay? So obviously, we talked about culture so many times, and here I'm bringing it up again, right? In order for us to actually care appropriately for our patients, we have to be culturally competent. Who is our patient? How do they feel? What are their questions? Who are they? What are they? Who are the clients with mental illnesses? What's their cultural background? What's their religious background? So in order to provide competent care, we have to identify strategies that fit within the cultural context of the patient. It's even on the slide. Bold it, understand it. So all of this comes into play of being an appropriate and amazing psych nurse. Okay? Does that make sense, you guys? Did I paint an amazing picture of what it is to be a psych nurse? Right? You guys, any questions so far? Thoughts, comments, concerns? Beautiful. Love it. I love it too. As you work through Mrs. M's assessment, you evaluate her level of resilience. Which other characteristic would you expect her to have? Optimism, patriotism, aggressiveness. Which one, guys? Let's explode the chat box. That you guys are going to pass my class? Are you guys resilient? Not yet. Yes. You have to say yes. Are you guys less stressed though? Less stressed? A little more open? A little more calm about the class? Excuse me. Curious about the class, for sure. More calm now. I love that. I love it. Thank you. I thought this slide was very cool. Look at this. Are you guys recognizing? Loving my simplicity of the content? Thank you. It's only week 1 though. Not to scare you. No, I do make it very, very, very simple. We do make it very simple. Oh, nice. I'm not monotone. Thank you, guys. Thanks. Are you guys recognizing these names? These are people who've left a mark in history. Beethoven, Virginia Woolf, Winston Churchill, they all had psych issues. Psych issues don't define you. Vincent van Gogh, look at this, Michelangelo, Ernest Hemingway, all of these guys. So NAMI is the largest mental health organization in the United States. Okay? Who else belongs on the list? I would say Kanye, Britney Spears. Who else, guys? Who else belongs on here? Any modern day celebs? Demi Lovato, Robin Williams. Yeah. Demi Lovato does belong there. Robin Williams. Anthony Bourdain. Do you guys know who he is? Yeah, I loved his show. He had like a food show on the cooking channel. It was really sad. He's a great human being. His show was about, he would travel to places and maybe he had like 1 hour layover, and he would eat at the places in the countries for that 1 hour until his next flight. And he was always so up to beat and just he was such a cool human. And then he committed suicide. Kate Spade should also be on here, right? Yeah. Jim Carrey, yes. See? Mental health is everywhere. Mental health is everywhere. Maybe after today's class, you can be more aware, right? Excuse me. My gosh. DSM-5. Okay, it's on your exam. Diagnostic and Statistical Manual of Mental Disorders. Okay, this is on every psych floor, whether this is a psych unit in the hospital, whether this is a psych clinic, whether it's a community setting for psychiatric patients. Okay, this is DSM-5. It's an official medical guideline of the American Psychiatric Association for diagnosing psych disorders. Okay, this is a big fat book with lots of psych disorders and with all the symptoms that have to do with each psych disorder. This is something that the psychiatrist uses. You don't use this to diagnose anybody because a nurse does not diagnose, remember? It's the psychiatrist who uses this, okay? One common misconception is that the DSM-5 is used to classify people. No, it classifies disorders, okay? Classifies disorders, okay? This is your psych diagnosis. So, schizophrenia, bipolar, depression, generalized anxiety. This is all taken from DSM-5, okay? When you do go on site, find DSM-5, look through it. It's this big fat purple book, okay? It's very interesting, okay? Look through it. Yeah. Remember, the psychiatrist uses this, you don't. You can utilize it if you want. If your patient has a diagnosis that you're not familiar with, let's say schizophrenia, schizoaffective type, whatever, you've never heard of it, you find the DSM-5 and you just look through it to educate yourself on that, okay? ICD-10. I watched a TED Talk about a girl who got into management, and she talks about how she struggled. Nice. TED Talks are really good. Yeah. TED Talks are really good. They have lots of good mental health related TED Talks. Yeah, I'll check that one out. Or send it to me. I am not a monster. Okay, I'm gonna check it out. That's true. Yes, I want you guys at the end of this term, I want you guys to see mental health patients as human beings, as regular human beings, okay? Okay, ICD-10 is basically cash, okay? This is what this means. Each diagnosis has a numerical code that is used. So these medical coders, each diagnosis has an ICD-10 code, numerical code, that we send out to insurances so we can get paid. That's all this is, okay? It's coding. We code diagnoses. We code signs and symptoms. Money, okay? That's all this is. It's good. In psych, there's a whole lot of money. Just saying. It's awesome to be a psych nurse, but the fact that you make so much more is a plus, right? Let's talk about them collectively. So DSM-5 is your diagnosis manual, right? Identifying interventions for issues a patient is experiencing. So DSM-5 is a diagnosis guide for medical treatment, right? Whereas your NANDA diagnosis is a framework, right? Ineffective coping mechanisms, hopelessness. This is the diagnosis that you have, that you give. You guys know the difference, right? So DSM-5, the psychiatrist diagnosis. NANDA is you. Risk for fall, risk for suicidal ideations, ineffective coping mechanisms, imbalanced nutrition. You guys are with me, right? Alive? And then ICD-10. ICD-10, it's the codes, coding. That's all that is. Okay? Whoa, chapter 2. DSM-5 is the primary diagnosis. Is that what you meant? Yeah.
I'm sorry, what do you mean by coding for ICD? What's the difference with ICD and DSM?
So DSM-5 is basically a diagnostic book with all the psychiatric disorders. Okay? When you open that book, you're going to see schizophrenia and the signs and symptoms that are all about schizophrenia. You're going to see depression and the signs and symptoms of depression. ICD-10 is basically a code. It's a numerical code that each disease has. So let's say schizophrenia is, I don't know, E20.5. It's not, but let's say it's E20.5. So schizophrenia equals E20.5. It's a numerical code. We send it out to insurance companies and we get paid. That's all that is. It's a numerical code so we can get paid. That's all that is. Mm-hmm. And then NANDA is the diagnosis that you give. You know, like ineffective coping mechanisms, hopelessness, irritability, whatever your nursing diagnosis. What is the most expensive? Oh my gosh, I don't know. I don't know what the most expensive one is. The way we make more money off of this is if we have, let's say, diagnosis, plus we can also utilize codes for the signs and symptoms, you know? So that's how we make a whole lot of money. Yikes. Would it be related to medication and treatment? What? The ICD-10, would it be related to medication? ICD-10, like I said, it's related to your diagnosis. Whatever diagnosis you have, each diagnosis has a numerical code. As far as insurance code, it doesn't matter what the insurance is, still ICD-10 is utilized. That's how you get paid. Yeah. I hope that made sense. Cool. Guys, we're on chapter 2. What time is it? We're good on time. We're very good on time. Come back 7:30 and we will continue. Are you guys good with that? I think we're good with that. I think we're good.